PQ is a 49-year-old woman who walked into the emergency room complaining of chest pain and shortness of breath. After a normal EKG, the doctors there sent her home because they think it's simply a panic attack. A week later, she's back with chest pain significantly worse than a week before. This time, they scan her chest and find fluid building up around her heart. The fluid collected in the sac around her heart called the pericardium, and it's not supposed to fill up with anything. The doctors also spotted something strange, a poorly defined defect on the wall of her aorta, a weak spot, or possibly a hole in the largest blood vessel in the human body. They drained the fluid. 3 days later, it came back. They drained it again. 6 days after that, still coming back, and this time there was blood mixed in. Something inside her was actively damaging the wall of her aorta, and nobody could see what was it. At this point, the defect had grown. The bleeding wasn't stopping on its own, so surgeons made the call to operate. To work on the aorta safely, they had to put her on total circulatory arrest. That means stopping all blood flow in her body temporarily, cooling her down, and operating in a completely still, bloodless field. It's one of the most extreme procedures in cardiac surgery, reserved for a situation where there's no other way to see what you're operating on. When they opened the aorta, they found it, a black sharp object, embedded directly into the wall of the vessel. It looked like a quill. A porcupine quill sitting inside this woman's aorta, having traveled there probably from somewhere in her GI tract. She had no idea how it got there. Weeks earlier, her dog had gotten into a fight with a porcupine. She'd spent the afternoon pulling quills out of her dog's face and body the way any dog owner would. Somewhere in that process, one quill ended up in her own mouth, or her foot, or her hand, and then her mouth. She swallowed it without even noticing. Swallowing foreign objects is actually common. People do it constantly, mostly by accidents, and the vast majority pass through the GI tract without incident. When an object pokes a hole through the esophagus, it's called a perforation, and it happens in less than 1% of cases. It's really rare, but it happens enough that doctors know the pattern. Sharp, rigid objects are the ones to do it. Fish bones are the most well-documented example, with over 100 recorded cases of a swallowed fish bone tearing through the esophagus and damaging the aorta right behind it. The esophagus and the aorta run almost side by side in the chest. That proximity is normally irrelevant. It only becomes dangerous when something sharp punches through one wall and keeps going into the next. That's exactly what the quill did. It punctured her esophagus first, then it kept moving slowly until it reached the aorta itself. The problem is that porcupine quills aren't just sharp, they're barbed. Microscopic backward-facing structures along the shaft act almost like a harpoon, gripping tissue and resisting being pulled back out. Surgeons removed the quill and repaired the damaged section of her aorta. Luckily, PQ fully recovered and was discharged 3 weeks later. Thank you for watching, stay safe, and I'll see you next week. Goodbye.